Today in our Ask Our Doctors, we're revealing what you can do to have better sex tonight. So before we answer our first question, you may want to send the kids into the room next door. Avita wants to know about the G-Shot, a controversial new procedure that some women say leads to mind-blowing sex. Lisa, what's the G-Shot?
It's an injection of collagen that's placed at the G-spot, which stands for the Grafenberg. It's named after a German gynecologist, actually. And it's a spot about 2/3 on the front wall of the vagina where a lot of women can be stimulated. It can help them with orgasm. This spot works for, some women, doesn't work for all women.
Well, Avita and a friend wanted to go ahead and try out the shot. We sent our cameras along.
Hello, ladies. I want to welcome you to our G-Shot party.
Hi.
I'm Dr. David Matlock, and one of the procedures that I do in my practice is G-spot amplification, or the G-Shot. What we do with the G-spot, we enhance it, we augment it, we make it bigger with that enhanced sexual gratification. All excited?
Yes. Oh my gosh, so excited. I usually don't orgasm internally. I would like to just have as much satisfaction as the men seem to usually have.
The reason why I'm into this procedure is because I want to enhance my relationship with my boyfriend.
We are injecting into the G-spot is a collagen base. It lasts for about 4 months.
This is probably the strangest thing I've done ever in my whole life.
Okay, now here we go. Here's the collagen. Now I'm going to inject. See? Done. Did you feel anything?
No, I didn't.
Oh, it's being augmented and swelling up from the very eyes.
I'm really anxious just to see if it's gonna work.
They say a lot of women don't know where their G-spot is, so I think that I found it, but maybe after today I'll think different.
Well, Avita and Bia are here, and everyone wants to know, ladies.
It's out of control. Like, I can feel it.
Control.
I can feel it at work. I can feel it when I'm driving. I had to call my boyfriend. It's made a complete difference in my life.
No, the word is mind-blowing. Basically, it's that feel-good feeling every single time. So it could be such a distraction because, you're working, but yet you want to break away to have a quick sex break. So I definitely like this.
Yeah.
And I'm keeping it.
I recommend it for all women out there who might be a little frustrated about their sex life or not enjoying sex. This will take it to another level.
I mean, so what you're saying is you're stimulated all the time from this?
Yes.
It's not only...
More than usual.
Yeah.
Like,
I'm aware of it.
Right now?
Yeah, I can feel it right now.
Wow.
Yeah, Drew, sometimes we have some women who will say that it's like a low level of arousal. Some women will even say that it's kind of annoying. But women like it. I have some
It's
women
not annoying.
Some women will say that, you know what, doctor, I'm in the gym and I have a smile on my face. And some people think that I'm just really enjoying my spinning, but I'm actually sexually aroused. I have another patient who said she was driving down the 405. She was talking to a girlfriend in New York, and she just started laughing. The girlfriend said, what's wrong? She said, I just had an orgasm.
Now, is this typically for women that do get aroused but are just getting more aroused?
Yeah,
or
this is
it...
for normal sexually functioning women. Okay. It's not for women with sexual dysfunction. It's not for everybody, but it's there if you want it.
Show us what's going on when you give this G-Shot, because everyone is curious.
Okay, how this works. That's it. Bada bing, bada bang, right there. But that's the actual injection. It's very, very quick. It's about 8 seconds, based upon what the woman is telling me. And so those two green spots there indicate the location of the woman's G-spot on that speculum.
Okay.
Women ask, when can we have sex? I say, please just wait till you're out of the office.
Can you see the spot just by looking in there?
Yeah, but first, I think the most important thing for us to do is to educate the women on the G-spot. And I want the women to become in tune to it. That's what it's all about. If they come here, they use this, and they have it, and they understand it, and go out, don't need it anymore, that's great. That's fine.
Well, I didn't even know where it was. I thought I knew where it was. And then when he showed me on the model and then, we actually physically went there, I was so off base. But now I know where it is completely.
A single injection is 1.5 cc's. It's a thick collagen base. It's an FDA-approved product. But some women have said, why can't we have a double? I said, why not? So it'd be 2.5 to 3. These young ladies had the Whopper. They had
a double
3cc.
espresso.
Double.
Did it hurt at all?
The Doppio.
No, it didn't hurt at all.
What are the complications?
It's very, very safe. At most, what you can see from the injection site, a little bleeding or a couple of spots. So we do use a tampon to put pressure up there for 4 hours. The woman can remove it after that and engage in sexual activity.
But in terms of studies, this is somewhat new, and there aren't long-term, large amount of studies. So we can't absolutely say for sure there won't be problems. I mean, there probably isn't.
And this isn't a shot that every woman
Yeah.
needs to be going to get every 4 months. But how much does it cost?
It costs $1,850 for a single. It costs $2,500 for a double. Some patients may say $1,850 is a lot to pay for a G-shot. We like to say it's a small price to pay for such a bundle of joy.
But hopefully it'll soon be added into a woman's health plan.
Thank you for sharing your stories. Very fascinating.